Hi, I am Michelle Abadaka, and I'm the Community Liaison for Continuum Care Hospice. And I'm here to talk about what is hospice, why to utilize hospice, who is eligible, and who pays for it. So hospice care is designed to provide comfort and support to patients and their families when a life-threatening illness is no longer responding to cure-oriented treatments. Hospice is about helping patients live each day in their lives to the fullest extent possible, providing support to the patients and their families. Hospice treats the person, not the disease, focusing on care and not cure. Hospice is appropriate when the diagnosis that is not responding has a prognosis of 6 months or less. And so what hospice includes is a professional team, including a medical director, primary care nurses, social workers, spiritual counselors, hospice aides, volunteers, and other services such as musical therapists. Our team collaborates to create a care plan to provide a comfort and support care team to support the patient and the family. So an example of hospice care is a person that may have received a cancer diagnosis. It does have a prognosis of 6 months or less, and they no longer want to seek treatment. They don't want radiation, they don't want chemotherapy. They want to live their life to the fullest with their family and those surrounding them, and doing the things that they want to do in the much comfort as possible. So what that team would be is, so a hospice nurse would come in, determine what those care needs are, what kind of medications are needed, what equipment is needed, and what type of support is needed for the family. And there'll be ongoing visits about 1 to 3 times a week to support them. In addition, there's a hospice aide that would provide personal care, which includes bathing. It could include just comfort care. It could be helping them get to a wheelchair so they can go for a walk with their family. It just depends. It's all personalized. And they do a visit 2 to 5 times a week, and those visits are usually about 30 to 90 minutes. There's also a social work that's available to provide counseling and guidance to the family as well as the patient. And this may include just going through the grief process. It could be going through paperwork. It could be trying to connect with that sister that they haven't seen for 5 years. We also have a spiritual counselor that comes in and provides a support to whatever their spiritual beliefs may be. They could be sitting down and doing meditation with them. They could be praying, singing hymns, whatever it takes for them and supports them in where their spiritual belief may be. There's also a music therapist that we have that comes in and provides music. It could be singing music, it could be just talking about music, it could be singing hymns. And what we find is with music is very therapeutic and providing that support to reduce pain as well as to reduce anxiety for them. And our music therapist comes in as needed, typically about once a week. And they actually will make the arrangements with the family to provide the support for them as well. So as you can see, there's lots of different entities that are working together to support the patient and the family, and they are coming in to support them at various times throughout the day. They are not in the home 24 hours a day, but they are available via phone 24 hours a day. We have triage nurses available during the nighttime hours, as well as a nurse that can go and do visits in the middle of the night if necessary. Hospice is definitely an underutilized benefit. It is covered by Medicare 100%. It's also covered by Medicaid as well as other private insurances. And some of the other benefits that it covers is their medical equipment. And what that would include is a hospital bed, a wheelchair walker, bedside commode, oxygen, briefs, personal items, as well as any kind of medications that are associated to the disease in the process, and providing comfort and pain relief to them. Hospice is not limited to 6 months. Patients can come on and off of services. If a patient should choose that they want to maybe seek some type of treatment, that they can come off of hospice, and then if they decide to come back on at a later date, that is still covered under the Medicare benefit. The patient does not have to be bedbound or critically ill to be eligible for the hospice benefit. As I say, it's definitely an underutilized benefit to provide support to families during one of the most difficult times in their lives. That most Americans are not familiar with hospice, and most of them do not know that Medicare would pay for it. If you know somebody that falls within these criteria or you think might be eligible for it, I encourage you to reach out to their physician or a hospice organization. Feel free to reach out to me. I am Michelle with Continuum Care Hospice, and my contact number is 206-348-8142, and my information is also available on the Aging Smart website.